I'm Paul Villeneuve. I'm at Carleton University, and this is Matilda van Bosch at University of British Columbia now. And we're very pleased to be part of the CANUE project, and it's nice to see so many familiar faces in the crowd. And I'd like to say that we're the good news stories. We're the greenness. We're not the air pollution, the noise. You know, we do good things. So anyways, you see a picture from Ottawa. It's nice to sort of get some pictures of greenness from across the country. But just to give you a little bit of an overview on the study team, our green team involves Dan Krause from the University of New Brunswick, who's done a lot of work in greenness lately. Perry from Oregon State, Scott Lear, Daniel Raynham, who's boating around the Caribbean on his sabbatical right now, Audrey in Montreal, and we're always receptive to having input from others as well.
Right, so that was the overview of who we are. So I'm going to give a little overview of the state of the art of the research where we are now. And this will be relevant also when we look at the research gaps and where we need to focus the assessments and the things we're going to look at in CANUE. So if you look at systematic reviews which are done up to date, we know that mortality and both all-cause and CVD-related mortality, there's an effect, a positive effect of access to green spaces, urban green spaces. There is also studies that show that there is an impact on birth outcome, and mental health, cardiovascular diseases, and respiratory problems, mainly asthma has been studied, type 2 diabetes, and also perceived general health. For those that there is no plus sign behind, the evidence is still a little bit inconsistent, but there are enough studies and there are systematic reviews out there which show the effects on mortality as said. So much of the research has been looking at defined health outcomes like the ones I listed, but also there is research on the pathways and determinants of health, which you could separate into sociocultural pathways or ecosystem services. So if you look at the determinants, the pathways that have been looked at, there is the overweight and obesity, BMI, physical activity, increased social interactions in the community sense, the social cohesion, the social capital is supposed to increase by interacting in green spaces. Sleep disruptions have also been suggested as a pathway to better health. Equally, stress reduction, which is one of those pathways, sorry, where there has also been have also been done research on the physiological parameters like heart rate variability, cortisol, and these kind of stress hormones. Improved effect turns out to be the one pathway which there's most consistent evidence for. So it seems like improved effect is something which we can definitely relate to access to green spaces, which in turn has an impact on mortality, of course, and also cardiovascular diseases. Finally, also hypertension, which could be an indicator of several other determinants like stress, for example, and also insulin resistance, which would be related to diabetes, obviously. So then if you look at the more ecosystem services, the ecological parts which are related to access to green spaces or blue spaces for that sake, then we also know there is enough good evidence for saying that urban green spaces does have a reducing effect on the urban heat island. It's mainly in the cities we see this effect, so it's not so much on the countryside. And there is the estimates say like something between 1 and 3 degrees Celsius lower temperature where there are green spaces. And then there is less evidence, less consistent evidence when it comes to reduction of air pollution and also the reduction of noise. When it comes to noise, it seems to be mostly the perceived noise. Sorry, so it's not really, there is the same kind of noise, but the perception. Oh, there was that spoon someone was missing. Yeah, it's out to you there. Right, and then related to the biodiversity, that we as children would be more exposed to a biodiverse microbiota, which would have an impact on our immune system development. These are all suggested pathways, and there is some research done on that, but it's not enough to say that we have consistent evidence on that. So this would then relate to the research gaps where we could look further within the CANUE consortium And in Canada, there's not so many studies done on the infancy part of life, which then would relate to also, obviously, the life course approach. And also, as said, these other related pathways, for example, the autoimmune diseases, as I mentioned, which could be related then to immune system function. Also malignancies, cancers, nephropathy, which could be related to heat, for example, and then the stormwater management, which could have an impact on sanitarian issues and hygiene. As said, the early life exposure during pregnancy and also before conception is not much done. And then, as we always talk about, that it might be a too rough measurement to look at only NDVI, and there's also other kind of environmental parameters that we would like to look at. For example, blue space, also the urban tree canopy or tree canopy in general, and characterize features of green spaces. That is, of course, correlated to the NDVI, where we can't see very much about the actual accessibility, for example, whether there are any barriers to going into a park or a public open space. And also the duration of exposure that could be possible with some satellite measurements and monitoring data if you look at off a leaf or on leaf when it comes to trees, leaves. And then that it could be, there are studies showing, of course, that there is a general impact, and usually you see more impact of the green spaces in more deprived areas. However, there is also a tendency, of course, to this self-selection bias that more healthy, better educated people tend to have higher capacity to afford living in nicer green areas, where also usually the residence values, the costs for houses are higher. Also, as we talked about before, the health equity parameters or perspectives around that is another important thing to look at. And then the interaction between the different exposures like air pollution, noise, heat island, pollen, allergens, etc. When it comes to the net effects, because if you say that trees are good because they reduce, for example, the prevalence of asthma, then it could also be an increased prevalence due to the pollen emissions from trees. And cost efficiency, as the calculations, are not so many studies on that yet in Canada. Right? I think that's your.
Okay. So just in terms of some of the exposure data that we have in Canada now, there has been a national NDVI surface that's been created. Some of us have applied some surfaces in the past to some cohort and cross-sectional studies. There's also a lot of opportunity in terms of using some of the Google Earth data. Various cities also have tree canopy data. I know the city of Ottawa, for example, tags a number of their trees. There's been some work done here in Toronto looking at the relationship between a number of trees in various parts, whether it be backyards or along streets, and looking at health within the participants of the Ontario Health Survey. So there's a number of opportunities. Something else that's coming up more is the issue of blue spaces and making use of some existing water surfaces. And I think that's one direction we need to go over the next little bit, is sort of teasing apart the green and the blue spaces. So this is just some illustration of data that I mentioned appearing in the Cardinal paper, where they looked at tree canopies within the city of Toronto and self-reported health amongst participants of the Ontario Health Survey. So a lot of these epidemiological data sets that have postal code information, it becomes very easy, of course, to link the environmental data on a spatial scale. So one of the things that Eleanor asked all of our groups to do was sort of to put together a listing of various actions according to a number of different time frames for quick wins and things that we'd want to accomplish within the time frame of the CANUE. So one of them would involve refining some of those existing NDVI surfaces, incorporating the aspects of blue space, and also supplementing that with some local land use data as well, too. For some of the longer-term priorities over years 1 and 2, some of these would involve applying some of the surfaces to various epidemiological data sets, including the Canadian census cohort. Some of that work has been initiated. There's also been efforts to link some of the data to other cohorts like the National Breast Screening Study. John McLaughlin has mentioned the Canadian Partnership for Tomorrow project as well too. And as well the CCHS, the Canadian Community Health Survey, that gets administered by Stats Canada, provides an important opportunity to look at these associations, both from a cross-sectional nature as well as in a longitudinal, as these data are linked to things like cancer incidence and mortality. In terms of some of the longer-term goals, what I think we really need to get at is more of the aspects of green space related to quality, usability of green space, incorporating those into some of the epidemiological data sets, enhanced methods of back extrapolation with the Google Earth engines, and really try to develop these detailed surfaces for a number of the Canadian cities.
Yeah, no, this is just an example from the Enviro Atlas of the EPA in US, which is kind of a neat tool you can go into and stay on for the rest of the day, because you can make these wonderful little maps of different cities in US. So they kind of, what they have done is that they have listed the ecosystem services mainly related to health, and put it into different data layers and put it together with, for example, green spaces. So this is a map showing the estimated walking distance to a park and for different regions in this city, which I have forgot which one it is. Could possibly say somewhere. Sorry? Austin, Texas, exactly. Right, I should have seen that, of course. Anyhow, so you just check these different things and you get out whatever you want. The next one is on air pollution and the asthma exacerbations avoided by nitrogen dioxide removal by the urban green spaces. So this is something we could think about, making something similar or develop something like this based on existing data. Yeah, this was.
Okay. So another slide we were asked to present was, what other variables do we really want to capture to look at some of the impacts of greenness? And of course, these are all interrelated in the urban environments, as you've heard several times already. But in terms of some other features that might be relevant for looking at green space and how it might impact things like physical activity, things like lighting, crime statistics, that's come up in some studies, including some in Ottawa as well that I've been involved with. Again, getting more information about the specific features of green space, aeroallergens for looking at things like respiratory health conditions, and of course meteorological variables as well too. So in terms of funding, I think there's going to be enormous opportunities in terms of trying to take some of these surfaces, link them to epidemiological data sets. We did submit a grant to CIHR called the PLACE study. So what this had intended to do was look at the interrelationship between all these urban environmental exposures and how they related to mortality within the Canadian census cohort. Unfortunately, we just missed funding on that, but a number of the team members have identified other opportunities. So we're hoping to carve off pieces of it and try to put that out to other calls in the US and in Canada. There's also several applications that a number of us have submitted to various granting agencies. Dan Kraus has put in a proposal to look at relationships between residential greenness and a number of measures within the Canadian Longitudinal Health Survey. So that's a study of older adults that's being coordinated out of McMaster. I've also put in an application to CHR to look at birth outcomes, as has Matilda. And also there's a application that's been put in to look at the built environment assessment in Vancouver. So I think there's a number of things in the work, and hopefully some of them will be successful. And I think too, it's important to keep in mind, there's always these targeted funding calls that seem to come out. So, you know, the thing about greenness and a lot of these environmental exposures is they're relevant to so many different health conditions, and both to the elderly, to childhood health. So I'm very confident that there'll be a number of opportunities come up over the next few years. And we have 5 minutes for questions. So.
Yeah, we're here to answer them.
Thank you for the wonderful presentation. So I think there is an exciting work, you know, the growing body of research coming from urban ecology, you know, urban microbiome, or human microbiome. So it's basically looking at the invisible environment. So I was wondering if you can comment on that, some of the interactions, you know, if you're planning to work on some of these issues, looking at the interaction between the biodiversity and some of the pathogens and microbiota that, you know, that exist in our environment that is related to greenness, you know, the park access, that's much coming from more of an, you know, invisible environment that we can't really see. So, yeah.
Yeah, we would love to do that. I mean, that depends, within the CANUE consortium, it's supposed to be on what we can gather from existing data. And I know there are a few projects going on, yeah, which have this data included. So that would be very interesting, for sure, to include exactly, as you say, the biodiversity in terms of microbiota, but also the pathogens. And yeah, there's another track, of course, the vector-borne diseases, talking about pathogens, the kind of so-called negative aspects of the green spaces.
No, and well, I'll just add to that, some of the various data sets in a number of the cities will get at the types of species of trees. And I think once we get more information about characterizing green space on its, the various features of it, we'll be able to answer a lot more of those questions. We've relied almost exclusively on the NDVI, which goes from a scale of like -1 to 1, you know, -1 being virtually no greenness to 1 being very green. So we're just sort of at the tip of the iceberg in terms of getting at some of these features.
Yeah, and there was this nice example from Toronto, and that's why we would like to make this kind of inventory of the local land use databases within each city, where they had actually monitored every single street tree. It was only in the streets, and then they had also measured the diameter, breast height of the trees, from which you could make estimations of the tree canopy, and also the species, yeah, of the trees, which would be very interesting to look at, also from a pollen perspective.
And I just wanted to say that the microbiome is represented here from the child cohort, birth cohort study with myself and James Scott.
Good.
An example you showed, we've had from Environmental Protection of Agency in US, those thematic maps. Do you think, is there any opportunity to have the same data sets linked to Environment Canada or any other government agency at the federal level to have that perpetuity in seeing those analysis and data sets?
Yeah, I don't know enough yet. I just came to Canada, so I don't know enough about, but that is, of course, I mean, I think it's a really good inspiration resource.
No, and I think that at this time, you know, a lot of the pieces, the environmental exposures that are out there, we need to pull them together, and developing that kind of tool will be an important KT component of this project. But I think the work to sort of create something like that is so intensive that you'd have to find some funding vehicle to do it.
Thanks for the nice presentation. So I guess the biggest threat to the validity of these studies is the self-selection bias. And I would encourage you to think about which data sets you can link quickly that have mobility data. So you could do studies that are similar to what Mike Brower showed this morning in the mini symposium, where people move to higher, lower levels of greenness and see whether or not there's a longitudinal change in their health outcomes, and then also to be scanning the urban environments for natural experiments that are occurring, so that you could then do before and after changes in the quality of urban parks and gardens, because that too is going to at least partly eliminate the self-selection bias.
Yeah, no, I agree, and we're fortunate in the sense that some of the cohorts have recently been formed. The Canadian Partnership for Tomorrow cohort, the Ontario Health Survey, the Canadian Longitudinal Study of Aging, they're all longitudinal in nature. I think the CLSA is going to go for another 20 years or so, so it'll provide a lot of opportunities, and I completely agree with you, this self-selection bias is key, but we're fortunate in Canada that we have some cohorts we can look at these issues with.
Yeah, and that would also help with this extrapolation backwards.
Mm-hmm.
Yeah.
Hopefully it's short. Paul, you mentioned the National Breast Screening Cohort. It's probably one of the oldest cohort. Women were recruited in the 1980s, and most of them are still alive today. And I think with the old cohorts as such, we may be able to really look at not just acute exposure to the environment, but also cumulative exposure, and how mobility and cumulative exposure would affect outcome. When it comes to greenness, I'm not too sure whether there is such a thing as cumulative exposure to greenness, but when we look at air pollution, we often look at acute versus cumulative exposure. So just wonder what your thoughts are in that area.
Well, I'm glad you mentioned, Teresa, like the breast screening cohort, and for those of you who aren't familiar, there's about 90,000 women followed from the early 80s to about 2004. So it provides a great opportunity to sort of look at where women live and the areas of greenness in those neighborhoods, and can provide a good measure of cumulative exposure, especially for things like looking at even incidence of breast cancer. I know Mike Jarrett has been interested in modeling the different causal pathways between greenness, increased physical activity, whether it's independent, or how the effects are all related to incidence of breast cancer. So I think that provides a good opportunity. One of the challenges is going so far back in time, because of course various census areas have changed in terms of development, and I know Dan has done a fair bit of work showing that areas of greenness, the high areas, haven't changed much, in terms of the last 10 years. But I think an important thing to do is try to go back even further with some of these surfaces that'll be put into the CANUE data platform. But yeah, by all means, we're hoping to look at the cumulative effects of greenness in that cohort. So. Thanks.